Hello, dear listener. You are tuned into WellsRadio 89.3 FM, your preferred awesome radio. I'm reaching you live from Wells Broadcasting House along Alafin Avenue, Oluyole Estate, Ibadan. On that note, I want to welcome you to another episode of The Radio Doctor, where we dive into the world of medicine, health, and wellness. On this show, we explore medical facts, we debunk myths, and empower you with knowledge to live a healthier life. I'm your host, Dr. Tobiloba Ojo, and together we will navigate the fascinating realms of healthcare right here on your favorite radio station, Wells Radio 89.3 FM. And of course, if you have any health concerns you would like for us to discuss, please feel free to reach out to us via our email, wellsradiodoctor@gmail.com. Our email is wellsradiodoctor@gmail.com. Or you can send us a direct message on WhatsApp through 091 5499 893. I take that again, 091 5499 893. So and be rest assured that we'll properly examine your thoughts and health concerns. Again, I welcome you to Radio Doctor. I'm your host, Dr. Tobiloba Ojo. Ẹ káàbọ̀ padà sí orí ètò yín ètò wa Radio Doctor. Doctor orí rédíò, Doctor orí afẹ́fẹ́. Ní orí ètò yìí a máa ń tọpinpin gbogbo nǹkan tó jẹ mọ́ ìlera ara. Gbogbo ìlera la máa ń kó papọ̀. A dẹ̀ máa sọ nǹkan tó kẹnu, gbogbo nǹkan tó yẹ ká máa ṣe, gbogbo nǹkan tí ó fẹ́ rújú nípa ètò ìlera àbí nípa ìlera ara wa la máa ń tọpinpin, la máa ń sọ délẹ̀ dáadáa. And tá a ṣe ń ṣe yìí, ẹ máa bá wa lọ, ẹ máa yí kúrò. On this show today, we will be discussing something so fascinating, something so important. In fact, I got a feedback that, Doctor, why not discuss this? Why not discuss this? And I am here to serve you. I'm also here to inform you and also to empower you with information that will help your health. And what is that thing we are discussing today? Can you make a guess? Okay, we are discussing something so important. We are discussing something so vital. We are discussing something that many people don't get right, and is a common complaint. Yes, it's a common complaint. And what is that thing we are discussing? We are discussing headaches, understanding headaches. Yes, nǹkan tí mo ń sọ ni pé lórí ètò yín a ó máa sọ̀rọ̀ nípa orí fífọ́, ẹ̀fọ́rí. Nǹkan tá a máa sọ̀rọ̀ nípa ènìyàn pé báwo ni orí fífọ́ yìí, báwo ló ṣe lè yé wa yékéyéké, kí ló ń fa orí fífọ́ gan-an, kí ló yẹ ká ṣe torí bá ń fọ́ wa. Gbogbo nǹkan báyìí la ó sọ ní orí ètò yín Radio Doctor. So torí bá ń fọ́ yín àbí torí bá fọ́ yín ní ọ̀sẹ̀ tó kọjá, ẹ máa bá wa lọ. A ó máa sọ gbogbo nǹkan tó jẹ mọ́ nǹkan tó ìgbésẹ̀ tó yẹ kẹ́ ẹ gbé. Ẹ ti máa gbọ́ dáadáa lórí rédíò, lórí àwọn advertisement pé torí fífọ́ wá mú ẹ ju ọjọ́ mẹ́ta lọ tó wá ti lo oògùn kan àbí òmíràn, kàn sí dókítà rẹ. Gbogbo kíní yìí a ó máa sọ nǹkan tó yẹ ká máa ṣe ní gbogbo nǹkan tó jẹ mọ́ tá a ṣe ń ṣe ìtọ́jú orí fífọ́. A kò ní kàn mú yí pé orí fífọ́ lásán. A ó máa sọ kí ló ń fa orí fífọ́, irú orí fífọ́ wo ló wà. So we understand that headaches are one of the most common health complaints worldwide. It affects people of all ages, both the young and old, people of all backgrounds, the rich, the poor, even people that have visual impairment, people that have even physical impairment. It cuts across all population of people. And while they are often dismissed that, it's just a minor thing, headaches, but headaches can be so serious that it can impact on daily lives. It can impact on productivity. It can impact on the overall well-being of someone. And understanding the different types, the different causes and management strategies for headache is crucial for effective treatment and also to know how we can prevent. Because wọ́n sọ ní pé orí fífọ́ pín sí oríṣiríṣi ọ̀nà, oríṣiríṣi orí fífọ́ ló wà. Oríṣiríṣi nǹkan ló dẹ̀ ń fa orí fífọ́. Nínú ètò yìí, a ó máa sọ gbogbo nǹkan tó ń jẹ mọ́ kí ló ń fa orí fífọ́, irú àwọn orí fífọ́ wo ló wà, kí ló dẹ̀ yẹ kí a gbé gẹ́gẹ́ bí ìgbésẹ̀ láti rí pé a wà ní ìlera tí ẹ̀fọ́rí kúrò ní orí. So we'll be talking about the types, and we know that when we want to classify the types of headaches, we broadly classify them into two: primary and secondary. So we classified it to two. That is the primary type of headache and the secondary type of headache. And primary headache occur independently and are not caused by any underlying medical condition. However, when we start talking about secondary headaches, there is usually a symptom of another health issue. To help you recap and help you wrap around that fact, there are some headaches that they happen without any other underlying health condition. Those are the primary types. But for the ones that happen due to, there's an infection somewhere, there's a blocked pathway somewhere in the head, those ones are the ones we call the secondary types. So let's take the primary types. If we want to speak about all forms of headaches today, I'm sure you would keep listening. We'll have part 1, we'll have part 2, we'll have many parts just speaking about headache. But with these two broad types that I've classified it with, it will help you better understand the commonest type of headaches and how to work your way into achieving a state of calmness, a state of not having headache. So we'll talk about the primary type. The primary type, the most common type, is the tension type headache. Yes, they call it tension headache. And these are the ones, is the most common actually. It is characterized by a dull, achy pain that is, you feel a tight band, like a band is around the head. It's almost always generalized. And what causes this type of headache? When you're stressed, you can have the tension type of headache. When you have poor posture, it can cause this tension type of headache. When you have a lot of muscle tension, you can have this type of headache. And those are the common triggers of this tension type of headache. Tension headache, generalized like a band is around your head. Then we talk about one that it can almost feel like the person is about to lose it. That's the migraine. And migraine headaches are intense. They are throbbing. And they often, sometimes, they can come with what we call nausea, feeling like vomiting. And even sometimes people outrightly vomit. And some cases, there's what we call sensitivity to light. We call it photophobia, which means that when the person is in a well-lit room, there's a torchlight shone on the person's face, the person will have that kind of serious, severe throbbing and intense headache, and this can last for hours. Sometimes it lasts for even days, and it can severely impair the person's activities. That's the migraine type of headache. It's intense. In fact, the person will almost feel like, am I going to die right now? And we also have the third one I will talk about. So we are still talking about the primary type of headaches. We've talked about the tension type of headache, which feels like a band around your head. We've talked about the migraines, which are the sharp, intense ones that can come with feeling like vomiting or even outrightly vomiting, and the photophobia, where there's sensitivity to light. Then we also have the cluster headache. And this one, they are excruciating, painful headaches that occur in clusters and often it happens almost at the same time of the day and at the same time at night. And they typically last for 15 minutes, sometimes 3 hours, and they may even occur several times a day for weeks or months, and they are followed by remission, that is, they go away. So let me just wrap it up for you so you can understand. When you are feeling a kind of generalized burn around your head, severe pain, yes, it's a bit dull, yes, but it's achy. You can call that a tension type of headache. You can remember that and say, oh, I feel tense in my head. That's the one associated with all the stress or muscle tension or poor posture. But when you start having sensitivity to like a very sharp pain, most likely that can be the migraine type of headache. And when you have the headache is coming at a specific time, it comes like in bands, then that's the cluster type of headache. Of course, we still have more types of headache, but these are the commonest. These are the ones that are classified under the primary headaches. And remember, as I told you, the primary headaches are the ones that there's no underlying medical condition that is associated with it. It's not like the person has a flu. It's not like the person has malaria. It's just an isolated form of headache. So we'll move on to the other classification, the other type of classification, and we'll start going through the sub-classifications. That's the one of secondary headache. Yes, this one is the one that many people would feel when there's an underlying condition. For example, when there's a sinus headache. Yes, sinus headache is the type of headache where there's an inflammation or infection of the sinus cavity. And sinus cavities are just like the pathway, the tract in which your airway flows. So, funny enough, when you look at a skull, there are some depressions in the skull. There's maxillary sinus, there's ethmoid sinus. There are sinuses in the brain where air travels, passes through. And when there's a blockage with this, you can have different types of sinus headaches, and this can result to pressure and pain around the forehead, because of course there's a sinus in the forehead, around the cheeks, that's where the maxillary sinus is, around the eyes, around where the ethmoid sinus is. And we know that these sinus headaches, once you treat, maybe the person has sinusitis, inflammation of the sinus, or the person has some polyps or some kind of masses or growths that is causing the airway not to flow and is blocked with mucus and everything. This takes care of the headache, and the headache goes immediately. That infection or that condition that affects the sinus, it goes. And then we also know that sometimes when you do a lot of using of medication, we have medication overuse headache. For example, prolonged use of medications like prolonged use of painkillers and prolonged use of some medications that they have a neurological pathway in them. So we know that overuse of all these drugs can cause a rebound headache. It will go, then come back forcefully. That's the medication overuse type of headache. Then we know that there's headache due to trauma or injury. For example, if someone sustains a head trauma, maybe a concussion or other injuries where there's a big impact, especially when people have all these Okada, motorbike accident or something, there's this very bad headache that comes due to the impact of the accident, and this is the headache due to trauma. Of course, we know that when you have malaria, one of the symptoms that it may come with is headache. Of course, you might have bitter taste of your mouth, you might have joint pain, but one of the commonest symptoms of having malaria is that you have an headache. Of course, when you hear of typhoid, to people who come down with typhoid to also have a form of headache that it comes, it goes, it comes, it goes, it comes, it goes, or sometimes it can even be protracted when the infection is getting intense in the person's system. And of course, typhoid too is one of the commonest causes of headache. Of course, when people have ear infections, as they are having the ear infection, they are having the earache, it radiates to parts of their head, and that is also anything attached to your head. Of course, your ear is attached to your skull, can also cause headache. Of course, people that have toothache, for example, maybe they have dental caries, they have tooth decay, they can come down with different forms of headache. You can see all these ones are all they are all secondary type of headache. Of course, if someone has a refractive error where we say, oh, the eyes is either long-sighted or short-sighted or astigmatism, and the person can't really read from afar, the person is squinting and everything, can have a lot of headache around the eyeball, and this is also vital. This is something to also understand, that headache can come even from not using the right prescription glasses, or the person that has an undiagnosed eye defect can also come down with consistent headache over time, especially when the person needs to strain just to read something or to look at something from a distance. We also know, and it's a known fact, that several things in the body can come and mask itself in form of headache. For example, when you have for example, if you have catarrh, which is also the form of sinusitis I've spoken of earlier, and you just have flu, just common flu and everything, and rhinitis and all those things, you can also still come down with headache. We also know that, yes, hypertension is a silent killer. Yes, it's a silent killer, but some people get so lucky that the first sign they used to know that they are hypertensive is that they have headache. Nǹkan tí mò ń sọ ni pé oríṣiríṣi orí fífọ́ ló wà. Ẹ̀fọ́rí oríṣiríṣi ọ̀nà ló pín sí. A ó sì máa pín sí igba ọ̀nà méjì. A máa wo ìtí ó jẹ́ pé ẹ̀fọ́rí yẹn ó dá wà fún rẹ̀ ni, ìyẹn tí olóyìnbó ń pè ní primary headache. A dẹ̀ máa wo ìtó jẹ́ pé ó sopọ̀ mọ́ àìsàn kan tàbí òmíràn. Fún ìtí ó kọ̀ dá wà, a mọ̀ pé ìkan wà tí wọ́n ń pè ní ẹ̀fọ́rí túlú àbí orí fífọ́ túlú, ìyẹn tí olóyìnbó ń pè ní migraine. Eléyìí ó máa ń dùn yàn gan, á gbá lórí èèyàn gan bíi pé orí fífọ́ yìí mi rí irú ẹ̀ rí ní ayé mi. Bẹ́ẹ̀ ni ẹ̀fọ́rí túlú ṣe máa ń wá. Ó ń gbà míì, ó máa ń ṣe wọ́n débi pé a máa ṣe bí pé wọ́n fẹ́ bì àbí kán tiẹ̀ bì, àbí tí wọ́n wà níbi tí iná wà, ó máa ṣòro fún wọn láti lè ṣe iṣẹ́ níbi tí iná wà, because orí fífọ́ yẹn máa pọ̀ sí níbi tí iná wà, bí ibi tí bóyá wọ́n tan láǹpù ni àbí wọ́n tan torchlight sí wọn lórí ni. Orí fífọ́ yẹn á tún bẹ̀rẹ̀ gan, ó lè máa lọ fún wákàtí àbí kó tiẹ̀ máa lọ fún ọjọ́ kan, ọjọ́ méjì, ọjọ́ mẹ́ta, àfi tí wọ́n wá sí ilé ìwòsàn láti wá ṣe ìtọ́jú irú orí fífọ́ yìí. A sì mọ̀ pé àwọn kan wà tí wọ́n ń pè ní tension headache, tó jẹ́ pé tá bá ti ṣe wàhálà, tá bá ti ṣe iṣẹ́ gan ní orí ẹ̀fọ́rí yìí, á wá dàbí pé wọ́n so nǹkan mọ́ wa lórí. Ìyẹn là ń pè ní tension headache. Ìyẹn stress ló máa ń fà, àbí tó bá jẹ́ pé a ti ṣeṣẹ́, ara ti fẹ́ sinmi, a sì ń force ara wa, àbí ẹni tí ò sùn dáadáa, ìyẹn ni à ń pè ní tension headache. Ẹ̀fọ́rí tó jẹ́ pé ẹ̀fọ́rí tó mú wàhálà wá, tó wá sí wa lára nítorí pé a ti ṣe wàhálà, ìyẹn là ń pè ní tension headache. A ṣe ní cluster headache náà. Eléyìí ó máa dà pé gbogbo ẹ̀kọ́ so papọ̀ mọ́ra wọn, ó sáré wá, ó sáré lọ, ó sáré wá, ó sáré lọ. Ó lè wá fún bí ìṣẹ́jú márùndínlógún àbí kó wá fún bí ìṣẹ́jú mẹ́ta á tún lọ. A máa rí pé irú orí fífọ́ yìí ìgbà kan ló máa ń wá, bóyá orí fífọ́ yẹn bóyá aago 12 ló ń wá fún èèyàn kan, fẹ́lòmíì báyìí bóyá bí aago 2 ló máa wá fún ẹni yẹn. Oríṣiríṣi orí fífọ́ tá à ń pè ní primary headache, ìta ń pè ní orí fífọ́ tó dá wà fún ara rẹ̀. A sì rí pé orí fífọ́ tó mú pé àìsàn kan wá ló ń jẹ́ kí orí fífọ́ jẹyọ, ló ń jẹ́ kí ẹ̀fọ́rí jẹyọ, ìyẹn náà tún wà. Bí téèyàn wá ní kàtá tó jẹ́ pé gbogbo ọ̀nà fún gbogbo imú ló ti dípọ̀ torí kẹ̀lẹ̀bẹ̀, torí kàtá tó wà ń bẹ̀. A máa rí pé gbogbo eléyìí ẹ̀fọ́rí lè máa fẹ́ wá ní gbogbo iwájú orí tá à ń pè ní ọpọ́n àbí ẹ̀kẹ́, àbí kó so papọ̀ mọ́ ibi ojú. A sì rí pé ìmíì náà tún máa ń wà tó jẹ́ pé téèyàn wá lògùn ara ríro yẹn lọ báyìí, ẹ̀fọ́rí akọ̀ ṣàdédé dé sí àgọ́ ara èèyàn. Orí fífọ́ sì wà tó jẹ́ pé téèyàn wá ṣubú, bóyá èèyàn ṣubú lórí ọ̀kadà, èèyàn forí gbá ni o àbí èèyàn ṣẹlẹ̀ l'accident ni o, orí fífọ́ irú yẹn náà tún wà tá à ń pè ní headache due to trauma and injury. A sì rí pé ibà, malaria ó máa ń mú orí fífọ́ wá, typhoid òun náà máa ń mú orí fífọ́ wá. Téèyàn wá tiẹ̀ ní kòkòrò kan tó wọnú etí tá à ń pè ní ear infection, eléyìí náà lè mú orí fífọ́ wá. Téèyàn wá ní eyín tó ń dàyàn láàmú, eléyìí náà lè mú orí fífọ́ wá. Àbí tí wọ́n tiẹ̀ yọ eyín yẹn fúngbà díẹ̀, orí fífọ́ ó máa wá. Bó a mọ̀ pé ìfúnpá gíga púpọ̀ ní gbogbo ìgbà kò kì í mú nǹkan kan wá, débi pé a máa ń pè ní silent killer, pé ó pààyàn kò fúnyàn ní àmì. Bó àwọn èèyàn míì máa ń lọ́kì tó jẹ́ pé wọ́n kàn rí porí ń fọ́ wọn, wọ́n kàn sọ pé ẹ yẹ ìfúnpá yín wò, wọ́n á rí pé ìfúnpá ló ga tí orí fífọ́ yẹn fi wá. So gbogbo kinní ló ń so papọ̀ láti ta fi ń rí pé orí fífọ́ ọ̀kọ̀ kì í ṣe nǹkan tí èèyàn ń fi ọwọ́ yẹpẹrẹ mú. Kò ń ṣe gbogbo orí fífọ́ náà ni èèyàn ń lo paracetamol sí. What I'm trying to say is that it's not all headaches that you should just ignore and just use a form of painkiller, or you've used a form of analgesic and you just say, oh, thank you, God. Some of them will need you to quickly attend to your health by first going to your medical professional. So as I'm coming back after the short musical break, we'll be discussing the causes of headaches, the common causes of headaches, and also we'll be discussing how we will be able to effectively manage headache before presenting ourselves to facilities. Of course, I will also tell you what we do in our health facilities for people that present with headache. Nǹkan tí mò ń sọ ni pé by the time tó máa fi lọ fún break díẹ̀ pé gbogbo nǹkan tí mo sọ yìí kẹ́tì mú lò, kẹ́tì wò pé nǹkan báyìí ni radio doctor sọ gbogbo kìíní àwọn how to máa sọ pé kí ló ń fa orí fífọ́ gangan yẹn tá à ń pè ní causes of headache. Then àwa tún máa wò pé báwo ni nǹkan wo la lè ṣe, nǹkan àbí òmíràn wo la lè ṣe tó jẹ́ pé gbogbo nǹkan tó jẹ́ ẹ̀fọ́rí, ìgbésẹ̀ tá ti gbé lélẹ̀ ká tó rí doctor, àti gbogbo ètò jẹ́ pé immediately tá bá ti feel ẹ̀ báyìí hospital yá nìyẹn. So ẹ má yí kúrò, Wells Radio lẹ́ṣẹ̀ wá. I'll be back shortly.
Will I fathom or comprehend the slur you give? Tell me, where do I begin? away. Look at my hands up. Kimake be cherubim. Tabi said I feel alone. Lord, Timo, why you want him fisher, Shobora. Your mercy, your goodness, in my finger, and I feel it. Oh, I see it. Gratitude, this is. I saw it, everything in me. I said, show, yes. With everything in me, I said, show, yes. Cause every time I look to my right, every time I look to my left, all I see all over me is your faithfulness. Every time I look up, down, middle, every time I look from top down below, all I see all over me is your faithfulness. Is your faithfulness. Oh, I know. I still cannot fathom or comprehend this love you give. Tell me, where do I begin? Tell me, where do I begin? Look at my hands up. Kimake be cherubim. Tabi said I feel money low. Low, Timo, why you want him fisher, Shobora. Your mercy, your goodness, in my finger, and I feel it. Oh, I see it. Gratitude, this is. I saw it, everything in me. I said, show, yes. With everything in me, I said, show, yes. Cause every time I look to my right, every time I look to my left, all I see all over me is your faithfulness. And every time I look from up in the middle, every time I look from top down below, all I see all over me is your faithfulness. And this your faithfulness, show, yes. With everything in me, I say, show, yes. Cause every time I look to my right, every time I look to my left, all I see all over me is your faithfulness. Your faithfulness.
Ẹ káàbọ̀ padà sí orí ètò yín, ètò wa Dókítà orí Radio Doctor. Welcome back to your show, our show, Radio Doctor, where we talk about myths, where we talk about medical myths, and we dispel all the myths and empower you with information that are quality, and we are ensuring that your health remains our priority. So earlier in the show, I've already said that what is headache. We've defined headache, and we've also been able to let you know that there are different types of headache, and we classified it into two major types: the primary headache and the secondary headache, where the primary are the ones like tension, cluster headache, migraine, and the secondary ones are the ones like the ones due to sinus infection, sinus related, or medication overuse, the ones like ear infection, the ones like ear even headache due to maybe there's an impact like a trauma to the head, maybe due to a road traffic accident or whatnot, or the ones that come with malaria, the ones that come with typhoid, ear infections, and almost, or I made sure I mentioned that almost every symptom can mask themselves around headache. For example, some people are so lucky to get to know their BP status when they discover that they just have this unending headache, and that's a sign of having hypertension. But usually hypertension doesn't come with signs. That's why we call it silent killer. So don't wait for you to be having a headache before you start checking your blood pressure. Make sure you check your blood pressure consistently. We say know your numbers. Go to the nearest facility near to you and make sure that you check your blood pressure. You know your blood pressure. It is very important. You also know your blood sugar levels, and all these are vital, as we've already discussed in one of the episodes on medical checkup. So we'll be building on what we've learned so far, and we'll be talking about the causes of headache. The underlying cause of headaches can vary depending on the type and the individual factors of a particular person. For example, while some headaches can have clear triggers, some can be a bit complex, can be a bit multifactorial, can be a bit hard to get to the root of it. And common causes include genetics. For example, there's evidence to suggest that genetics, that is what you are born with, can play a role in predisposing individuals to headaches, especially migraines. Some migraines run in family, and there's also some environmental factors that can cause someone to come down with headache. For example, external factors like bright lights, having loud noise, strong odors, and change in weather can trigger headache in people that are susceptible. For example, if you live in a very loud place, maybe you live where there's a lot of noise, there's an industry near you, something like that can be a causative factor for your headache. Also, we know that hormonal changes, for example, fluctuations in hormone levels, particularly in women, can trigger migraines. And many women, they've been found to report experiencing migraines, especially during menstruation, especially during pregnancy, or after they get into menopause. And this is to show that there are some hormonal play when it comes to headache. Then also there are some stress and emotional factors that can lead to headache. For example, if there's a lot of emotional stress, there's anxiety or depression in some people, or some psychological factors, this can contribute to the stress type of headache, which we call the tension type headache. And sometimes even in migraines, when someone is overly stressed emotionally, the person can come down with headaches. Then also we know that some food that people eat can be a trigger. Some food and drinks that people take into their mouth and ingest can be a cause of headache. For example, there are some certain food and beverages such as alcohol, caffeine, cheeses that are aged, processed meats have been found to be triggers for headaches. For example, alcohol. Let me explain how that happens. Most times when people take alcohol, especially in excess, the next thing they do after is that, they start urinating, and this forms a deficit in their body. There's dehydration, and dehydration is a known cause of headache. So when someone is dehydrated, of course, the person will come down with headache. Also, caffeine, all these caffeinated drinks and all that have been known as they are stimulating you to be very active. The side effect for most of them when they start to wear out is that headaches can ensue. And also we know that processed meat, even aged cheeses, can cause a lot of toxins in the body that causes headache. And We will build on that again by letting you know that your sleep is important. For example, if you have sleep disturbances from lack of sleep, irregular sleep patterns, you don't have an exact time you sleep, you don't have an exact time you wake up, or poor sleep quality, poor sleep environments can increase the risk of developing headache. Also, what I will say is that your posture, especially when you are causing a lot of muscular tension, if you sit for too long, if your neck is tense, if you don't maintain the correct posture, your shoulders are not well placed, this can cause the tension type of headache. And of course, we've also mentioned that medical conditions like hypertension, like sinus infections can cause secondary headache. So let me wrap it up for you so you understand the commonest causes. 1 is genetics. 2 is environmental factors like bright light, loud noise, and all that. You can also have hormonal changes causing headaches. That's the third one. You can have stress and emotional factors also causing headaches. That's the fourth one. The fifth is dietary triggers. The sixth is sleep disturbances. The seventh, posture and muscular tension, and also medical conditions, which is the eighth one, can cause headaches. So nǹkan tí mo sọ ni pé oríṣiríṣi ọ̀nà ni ohun lèèyàn lè gbà láti ní ẹ̀fọ́rí. Àkọ́kọ́ ni pé nígbà míì èèyàn á rí pé tí bàbá èèyàn àbí ìyá èèyàn tó wá máa ń ní ẹ̀fọ́rí túlú, ó ṣeé ṣe kí ẹni náà kó jẹ́ ẹni tó máa ní ẹ̀fọ́rí túlú. Kò ń ṣe gbogbo èèyàn ló jẹ́ pé orí ń fọ́ bàbá mi, orí ń fọ́ ìyá mi ló ń kó lára bàbá àbí ìyá. Bọ́ a mọ̀ yí pé tó wá jẹ́ ẹ̀fọ́rí o, ó máa ń wá ní fámílì àwọn èèyàn kan tó jẹ́ pé ẹ̀fọ́rí tí bàbá ní àbí tí ìyá ní, ó ṣeé ṣe kó jẹ́ pé ọmọ náà máa ní irú ẹ̀fọ́rí yẹn. A sì rí pé àwọn tó ń gbé ní àgbègbè tí ariwo pọ̀ ní o, àbí iná tí ń mọ́lẹ̀ jù, àbí iná kàn ń ṣe bàlùbàlù, ó ṣeé ṣe káwọn náà máa ṣe kó jẹ́ pé wọ́n máa ní ẹ̀fọ́rí. A sì rí pé àwọn obìnrin ó common láàrin wọn, ó wọ́pọ̀, kò ń ṣe nǹkan tó kò wọ́pọ̀. Nǹkan tó jẹ́ pé ó máa ń ṣẹlẹ̀ dáadáa ni pé àwọn èròjà tá à ń pè ní hormone lára obìnrin, obìnrin ń ṣe nǹkan oṣù ni o, ó lè jẹ́ pé ó máa ń mú ẹ̀fọ́rí wá fáwọn èèyàn kan. Obìnrin ti di aláboyún ni o, ó lè mú ẹ̀fọ́rí wá fún àwọn èèyàn kan. Àbí obìnrin nǹkan oṣù ti padà ni o, ó máa ń mú ẹ̀fọ́rí fún àwọn èèyàn kan, nítorí pé a mọ̀ pé èròjà kan wà nínú ẹ̀jẹ̀ tá à ń pè ní hormone tó jẹ́ pé oríṣiríṣi ẹ̀fọ́rí ló máa ń wá tí àwọn hormone yìí bá ti ń lọ sókè àbí tí wọ́n ti ń lọ sílẹ̀. A sì mọ̀ pé téèyàn wá ṣe wàhálà náà, àbí téèyàn wá ní àníyàn kan, ara ò ṣe gírí dáadáa, inú èèyàn ò dùn, gbogbo eléyìí náà ó lè fa ẹ̀fọ́rí. A lè rí pé àwọn oúnjẹ kan wà tó jẹ́ pé lọ́pọ̀ ọ̀gbà wọ́n máa ń fa ẹ̀fọ́rí. Àwọn oúnjẹ tí wọ́n ti sè jù, processed meat, wọ́n ti process oríṣiríṣi nǹkan ló ti ṣe, ó ní expiry date, gbogbo àwọn can tí wọ́n máa ń gbé sínú can yẹn, ó ṣeé ṣe kó máa fa ẹ̀fọ́rí nínú àwọn èèyàn kan. A sì rí pé àwọn èèyàn tó wá mọtí náà, tó wá ti mọtí, tó wá ti tọ̀ báyìí, ẹ̀fọ́rí dé làwọn èèyàn míì máa ń pè ní hangover, nítorí pé gbogbo omi tó yẹ kó wà lára ni ẹni yẹn ti tọ̀ dànù. A lè rí pé tó wá ti momi, ó ṣeé ṣe kí ẹ̀fọ́rí yẹn kó lọ. So ẹni tó wá jẹ́ pé kò tọ́jú ara ẹ̀ tó, ó mọtí lámùpara, ó ṣeé ṣe kí orí fífọ́ jẹ́ nǹkan tó máa bá jà jù ní àgọ́ ara. A sì rí pé àwọn èèyàn tó wá mu coffee náà, gbogbo nǹkan tó ní caffeine, gbogbo nǹkan tó ní cola, ó máa ń jẹ́ kí ẹ̀fọ́rí kó jẹ́ nǹkan tí wọ́n tó ń ṣe wọ́n jù lára. a lè rí pé ẹni tí ò bá sùn dáadáa ó kanra ni kò kanra ni ó lè máa mú ẹ̀fọ́rí wá. Àbí ẹni tí ò wà ní time tó ń sùn èní ó lè sùn ní aago 9 àbọ̀ ọ̀la ó lè sùn ní aago 3 òru. Gbogbo nǹkan báyìí ó máa ń jẹ́ kí àwọn èèyàn míì náà ní ẹ̀fọ́rí. Àbí ẹni tí kò jókòó dáadáa ni ìyẹn tá à ń pè ní posture, eléyìí náà lè fa. Àbí ọrùn ẹ̀ tó wá ń ṣe iṣẹ́ lórí kọ̀ǹpútà ó bend ọrùn ẹ̀ bákan, àbí ó dúró fún ọ̀pọ̀ ọgbà, àbí ó wọ́ orí sẹ́gbẹ̀ẹ́ bákan. Gbogbo eléyìí lè fa ẹ̀fọ́rí. A sì rí pé oríṣiríṣi àìsàn ara náà ló máa ń mú ẹ̀fọ́rí wá, tá ti sọ, bí ìfúnpá gíga, bí pé èèyàn ní kàtá ni. Gbogbo eléyìí náà ó lè mú ẹ̀fọ́rí wá. So I'll be talking about the management and treatment of headaches. For effective management of headache, it often involves the combination of lifestyle modification, self-care strategies, medication intervention that are tailored to your individual specific needs. What I'm trying to say is that once you have a headache, doctors don't just give you paracetamol. We try to probe and also investigate what is causing the headache before we implement the lifestyle modifications, before we implement what you can do as your self-care, and if there's a need, we will definitely give you some medications to help you cope with the headache. For example, lifestyle modifications like establishing a regular sleep schedule and prioritizing adequate sleep is one that is very important. You must have a regular sleep-wake cycle. Your sleep-wake cycle is your circadian rhythm. And one day, I believe, we'll speak more about sleep. And we will be able to dissect how well we should sleep. The recommendation is 7 to 9 hours. And how many people get 7 to 9 hours of good sleep every day? Also, you should be able to practice stress management techniques and relaxation techniques. For example, just meditating, taking a deep breath, just to calm your anxious mind, just to calm a stressful state, is one of the ways you can also implement as lifestyle modifications for managing headaches. For example, also, you need to maintain a good posture and avoid prolonged periods of sitting or standing. This is very vital and is one thing we as doctors and even physiotherapists will always advise you that always maintain a good posture, because it helps prevent different types of pain, including headaches. And then you should identify and avoid triggers. There are some specific food that can trigger headaches for some people. Some people, once they take coffee, they definitely start to have headaches. Some people, it's even nuts. Just something as basic as granite can cause headaches for some particular people. Then also identify environmental factors. Is there loud noise around you? There's a way you can control the noise that you would not be coming down with headache. There are earmuffs that you can use, earbuds that you can use that just blocks off the noise, and then you have a very calm state of mind. So all those are lifestyle modifications that you can use to effectively manage a state of headache. Then also there are some self-care strategies you can use when you develop headache. For example, applying cold or warm compress to your forehead or neck when you feel a lot of tension or you feel a lot of headache, because that causes what we call vasodilation. There's good supply to all parts of the vessels, the blood vessels that supply your brain, and it helps to calm you down. Then also resting in a quiet, dark room during a migraine attack. A migraine attack is not where you have a well-lit room. go into a dark room that is quiet, that is dark, and it will help you to manage your headache very well. Then stay hydrated. Remember I said dehydration is one of the commonest causes of headache, and avoid excessive alcohol consumption. Yes, this is important. Then engage in regular physical activity to promote overall health and reduce stress. Exercise is not stress, because exercise helps to relieve stress. Exercise is something you enjoy. Then when all this has been done, there are over-the-counter drugs, acetaminophen, ibuprofen, aspirin, that are used to relieve headache. However, don't be a chronic abuse of over-the-counter drugs. Once you use paracetamol for 1 day, please, once you use it 2 days, 3 days, you now want to keep using it, please go visit your clinician, because it might not just be headache. It can be secondary causes of headache, or even it can be something as serious as some brain problems or some tumors in the brain. So one can't just say headache is headache. Headache is not headache. We always try to find the causative factor of headaches before we manage. Then there are some different drugs, for example, some antidepressants that are used to manage some people's headache, or some anticonvulsants, some Botox injections, some anti-nausea drugs, some drugs that we call ergotamines, different types of drugs. But this is not for you to be using and abusing. It is for your doctors to prescribe for you. Then also we know that things like massage, chiropractic manipulations, a lot of acupuncture has been used as alternate forms of managing headaches. Then also, never forget your professional support. Always consult healthcare provider or headache specialist for accurate diagnosis and personalized treatment for your headaches, and keep a headache diary. This is the time the headache happens, and you will be able to follow up with your doctor that, okay, around this time, this is what I do before the headache comes up, and this can help you to better manage your headache. Nǹkan tí mo ń sọ ni pé oríṣiríṣi ọ̀nà là ń gbà láti dènà orí fífọ́, láti ṣe ìtọ́jú orí fífọ́. Nǹkan tí màá kọ́kọ́ mẹ́nubà ni pé ká ní àsìkò tá à ń sùn, ká sì máa sùn dáadáa. Wákàtí 7 sí 9 ló yẹ ká fi máa sùn, tí ariwo ò ní sí, tí iná ò ní sí, tí gbogbo wípé kòókòó jọ̀njọ̀ àṣé, gbogbo ilé máa fi ara wa sí ipò ìsinmi dáadáa láti jẹ́ kí ara wa balẹ̀. Ẹ̀fọ́rí náà ó máa láṣìírí pé torí bá ń fọyàn, téèyàn wá kọ̀ mú omi tó lọ́wọ́rọ́, téèyàn fi sí inú aṣọ, téèyàn fi ba orí, téèyàn fi ba iwájú orí, téèyàn fi ba gbogbo ọrùn, a rí pé orí fífọ́ náà ó máa ń lọ. Àti àwọn tó ní ẹ̀fọ́rí túlú, wọ́n kọ̀ lọ sí yàrá tí kò sáriwo, yàrá tí kò síná, eléyìí máa ń jẹ́ kí ẹ̀fọ́rí túlú kó lọ. A sì rí pé gbogbo nǹkan tó ń jẹ mọ́ ọtí àmupara, gbogbo kìíní ní ká yàgò fún, ká sì máa mu omi lóòrèkóòrè, nítorí gbogbo eléyìí yóò jẹ́ ká wà ní ìlera tó péye. Kò ń ṣe gbogbo ìgbà ní paracetamol lẹ́ni, paracetamol lọ́la, kíní lẹ́ni, gbogbo kíní yìí a gbọ́dọ̀ mọ nǹkan tó ń fa orí fífọ́ yẹn. So tó bá ti ń lo paracetamol tó ti ń ju ọjọ́ 3 lọ, kàn sí dókítà rẹ, because oríṣiríṣi nǹkan ló ń fa orí fífọ́. Orí fífọ́ tó ń pààyàn ó sì wà, àlàáfíà wa kò sì ní di fíàfíà. So I'll be wrapping up this show by letting you know that your health is in your hands. Your health is something that you must take into proper perspective. And we have this quote from Mark. His name is Mark Lawrence, and he says that some pain you can distance yourself from, but a headache sits right where you live. I take that again. Some pain you can distance yourself from, but a headache sits right where you live. So take your health very serious. Orí fífọ́ ó jẹ́ nǹkan tí a lè fọwọ́ yẹpẹrẹ mú. Àlàáfíà wa kò sì ní di fíafíà. On that note, we are wrapping up the show, and I'll be answering your questions when you send us updates or questions on, oh, this is the symptom I have. And don't forget to follow us on our Facebook, our Instagram, and X at Wells Radio 89.3 FM. And if you have any question whatsoever, feel free to send us an email in wellsradiodoctor@gmail.com, or you send us a WhatsApp message on 0915 499 893. I take that again, 0915 4999 893. And until next time, I am Dr. Tobiloba Ojo, also known as Daddy Ojo. Stay healthy and keep listening to Radio Doctor. God bless you.